Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So, in this presentation, we'll talk about the endocardium, which is the innermost layer of the heart, and the chambers of the heart. So, first is the endocardium. So the endocardium is the innermost, thin and smooth layer of epithelial tissue that lines the inner surface of all the heart chambers and walls. This layer is made of thin and flat cells that are in direct contact with the blood and flows in and out of the heart. Each heart wall is formed by a fold of endocardium with connective tissue between the two layers. However, rather than just being an inner lining of the heart, the endocardium also has an endocrine function. So this is one of the only layers of the heart that has a single cell lining that secretes the hormone endocardin, which is responsible for prolonging myocardial contraction. So next are the chambers of the heart. So the heart is a hollow organ divided into four chambers, that is right atrium, right ventricle, left atrium and left ventricle. So this figure shows the four chambers of the heart: right atrium and the right ventricle, left atrium, right atrium and the right ventricle. So first is right atrium. Right atrium is a broad triangular structure. The superior vena cava opens into dome of the right atrium and the inferior vena cava into its lower posterior part. The right atrium is a thin walled chamber that receives the blood returning from the body tissues. And this blood, which is low in oxygen, is carried in the veins, the blood vessels, leading to the heart from the body tissues. Next is right ventricle. The right ventricle extends from the right atrioventricle, that is tricuspid orifice, nearly to the cardiac apex. It then reaching the pulmonary orifice and supporting the cusp of the pulmonary valve. The ventricle possesses an inlet component which supports and surrounds a tricuspid wall. The right ventricle pumps the venous blood received from the right atrium and send it to the lungs. Next is left atrium. Although smaller in volume than the right, the left atrium has thicker walls, that is 3 mm on average. Its cavity and walls are formed largely by the proximal parts of the pulmonary veins. The left atrium receives blood high in oxygen content as it returns from the lungs. And the last is the left ventricle. The left ventricle is constructed in accordance with its role as powerful pump. Its activity is oval or nearly circular with walls about 3 times thicker, 8 to 12 mm, than those of right ventricle. And the left ventricle, which has the thickest walls of all, pumps oxygenated blood to all parts of the body, and these bloods grow through the arteries and the vessels that takes blood from heart to the tissues. Thank you.